Hello, everybody. Welcome to our monthly Recovery Cafe volunteer training. My name is Brian. I'm the program manager. It's nice to see you all here. Before we even get started, I will just say that this is going to be our last volunteer training that will be on Zoom. It'll be our last volunteer training of this calendar year. And then starting in 2022, starting January 2022, we will be kind of re-envisioning these volunteer trainings and call them School for Recovery workshops. And we will be hosting them in person here at Recovery Cafe. They'll be the third Wednesdays of the month. And that the time is going to be pushed back a little bit as well. It will be 2 to 3. Oh gosh, I should know this. Let me send it to you later. But
1:30 to 3.
Thank you, Marissa. 1:30 to 3. But we would love to see you guys all here for that. Of course, because this is a restaurant, we do have to have proof of COVID vaccination and wear masks to be here in the space. But we're really excited. We've already got some guest speakers lined up for that. If there are topics that you guys feel you'd like to learn about or you're interested in, let me know and we'll try to find the appropriate person. Which brings us to today. There was a request by some of our volunteers to learn more about motivational interviewing. This is a topic that we've touched on here and there, but haven't really dived very deeply into it. And so I had asked a couple friends of ours in the community, Kelli, Parcher, and Shannon to come help us out with this topic. So before I turn it over to them and let them introduce themselves a bit, I do want to orient us to Recovery Cafe and kind of the purpose of why we're even here. Most of you already know, Recovery Cafe is a peer support program. Our purpose is to build community for people who are in recovery. We define recovery very broadly. In fact, we say everybody's in recovery from something. The purpose here then is just to make connections, to build authentic relationships, to be ourselves, work on our own issues while other people work on their issues. Importantly, we're not treatment and not 12-step meetings. We support those pathways to recovery. What we're trying to do is offer an additional pathway or to fill some gaps where folks may not feel like they've been able to access other forms of support. In order to participate here, we ask everyone be 24 hours drug and alcohol free. And then there's 2 different ways to get involved, membership and volunteering. Members commit to attending 1 recovery circle per week and giving back in some way. Volunteers schedule shifts on a regular basis as either a cafe companion or a kitchen assistant or other special projects. We've got other recordings of volunteer trainings in the past that are posted on our website that talk a little bit more about the cafe companion role and some of the skills that you might need for other volunteer roles. So now that we're oriented to that, I do want to then turn it over to our guest presenters.
Thank you.
Kelli, Shannon, if I don't know who to ask to go first, but if you wouldn't mind just saying a little bit about your background, and then I'll give you the floor if that sounds okay.
Perfect. Thanks, Brian. Shannon, you want to go first with your introductions?
Sure. Hi, everybody. It is great to be here. I was really excited for the invitation. I work currently at the courthouse with court-involved youth. So they can be court-involved in lots of different aspects. So I've done that for 25 years for our Jefferson County. I also, which is really close to my heart, work on the state level. And I do a lot of trainings, and I instruct at the academy, the new law enforcement academy, where we do a lot of motivational interviewing, teaching and case management. And we spend a lot of time on this subject. I also work on the state level, kind of developing and implementing cognitive behavioral programs for youth that might need to really look at how they think through and give themselves permissions and how they feel and how that escalates, and then the different decisions they can make that have better outcomes. So we've developed those programs here. Kelli has been on that committee. It's a very small committee, so we're pretty proud that we've kind of brought that curriculum to the state. And then again, it is based heavily on motivational conversations and interviewing. And we'll talk about the difference between those two.
Perfect, thanks. Hi, I'm Kelli Parcher, and I somewhat mirror Shannon in the sense, but different. I also work with young folks in the juvenile justice center system running an alternative to standard detention. So instead of full incarceration for our young folks, we have some alternative approaches on how to work with those young people and keep them here in our community and get them connected to services and resources here locally. As well, I do some state training along with Shannon and some program development. We also both work for a organization, the Center for Anti-Bullying and Nonviolence out of Colorado, and kind of do training around getting that foundation of cognitive behavioral therapy. We're very much believers in that process and giving youth those tools early on, especially if we're trying to change the trajectory of keeping them at the adult system is a goal. And then my secondary hat is running a young adult or emerging adult housing program for 18 to 24-year-olds in our community who are struggling with homelessness or housing instability. That's me. That's us.
All right. I'm going to kick this off. All right. And we're going to try to make this a little bit as interactive as we can. I'll let you guys know that the motivational interviewing conversation and topic is one that is very, very the thing right now nationally and internationally. There's been some really great research on it. And it's been really, really brought to a lot of professionals in lots of different fields. Rolnick and Miller are the best to kind of get a lot of information on this. And this is a great book to pick up if you guys are interested in this further. It's a good read. It can get a little dry, but overall it's a great book, and I'll put that in the chat so that you guys can have that. And there's some really great resources online that you can do, like a little bit of a series of online trainings on it. It's a topic that when I train this at the Law Enforcement Academy, I spend 2 days solid on this for an introductory, and then we go back and we go back and we go back to it in further trainings. So what I really want to bring to you guys is this idea. Okay, clinical people, clinicians, and there are some on here, really go into their clinical appointments with the idea of motivational interviewing. Okay, that's where you're really going to dial in and dig deep, like Brian said, and you really have the intention of to come out as something on the other side of that meeting. Well, what I really want to bring to you guys, because I know we have some folks that are in the professional world, and some that are volunteers, and some that are just supporting other people. And so I want to bring up this idea that's a motivational conversations, because everybody can get to the point where they wear a hat of, I'm going to go into this with a motivational conversation idea. Like, I really want to have, when I walk in as a volunteer, or when I sit down with this person, I'm going to really wear the hat of, can I keep a motivational conversation? Okay. And so that's really what we're going to talk about. Because when you can just do a little, 10 minutes or passing by, giving someone some coffee, and you have this idea of a motivational conversation engagement, you can enhance somebody's commitment. You can start sparking that flame of change and why, and get them a little bit more dug into it, or at least have it in their mind where they're like, you walk away and they're like, oh, yeah, okay, right? And it's a great thing to consider when you're having interactions with people. And this isn't something that just comes naturally. I mean, I have seen a couple people that have this idea of a motivational conversation, but it really needs to be practiced. So when you hit that volunteer spot, or you are going to sit down with somebody that you care about, and they may be struggling a bit, then that's kind of the hat you would want to put on, is I'm going to keep my motivational conversation hat with this person. And the biggest thing about this is the collaboration and that intent of strengthening somebody's motivation or commitment. There, yes. So you're really going to try to strengthen the reasons for the commitment that they have towards change. Okay. And like Brian said, change can be so different in so many different areas. So, you know, that's one thing. As you come into contact with people and people you care about, you learn more about what that change is that they're working on. And even if it's just a toe in, that's still the starting of change. And you can have motivational conversations and keep that ball rolling. And when you do that, you increase their commitment, you increase their abilities, you increase their support. And so so this is a great picture, and not just because we're talking about the Recovery Cafe, but we're also thinking about when you're having a conversation with someone, and let's say a good friend, and you're sitting there and you're having coffee with them. Okay. What do you bring to that conversation? What kind of, when you really, or think about when you've had conversations with somebody else who's increased your commitment or your motivation to continue change, what kinds of things did you feel from that person? And you guys can just pipe up. Like if you think about times when you've maybe been struggling or you're contemplative or ambivalent about change, and you sit down with somebody who really cares about you, and you walked away feeling like, wow, that had a little shift in me. I feel a little more committed to change. What kinds of things did that person do to help you have that feeling or come to that conclusion? Bruce?
It's usually that
Well-
I feel like I'm the only person in the room that's really paying attention.
Yeah, Katie, that is it. Like you're the person in their room and they're paying attention. Okay, Bruce, what did you have?
I'll come back to me.
Okay, no worries. I saw you unmute, so I was going to jump real quick on it. Anybody else? Janet?
I guess
Are you talking? Oh,
Okay,
I guess
Bruce.
I remember now. I guess if the person like has a belief in me that I'm capable of doing something bigger than I thought I was.
Yeah. So it's almost like wind on your back, right? It's like they have this
Yeah.
belief in you that you're capable and that you can do it. Yeah, perfect, Bruce. What do you think, Janet? You're unmuted, so I'm just going to pick on you. Unmute.
I think it's just that sense that I see them as human, as a beautiful human being that deserves everything I know and everything I've got and all of my listening and everything. Just
Yeah.
seeing that person as a.
Yeah, that last part you said is so big, like seeing that person, like you're seeing them, they're human. Okay, perfect. Anybody else?
I think I might just add that, at least for me, when I'm sitting with somebody and talking about something important in my life that I want to change, there's like some level of accountability with that too. I've just disclosed that to somebody else. I've made it more real than just this thing that I'm thinking about.
Yeah, perfect. And so that's a great one, Brian, because if we hear someone starting that, right? So if you're volunteering or you have someone you care about that's going through kind of change and they're on board a bit, but they're still kind of ambivalent, really because sometimes that's a very subtle thing when they start saying it out loud. And so like Janet said, that listening part, and Katie, I think Bruce also said, you have to be hearing for it. And sometimes we go over it because we have other hats on. And so when you're really going into motivational conversations, one of the biggest things you can do is really have a good ear. And when you hear a bit of it, that's key. Then you know to really listen and start acting like that person's the only one in the room. Like they're this human and they have you have a belief that they can actually do this. Okay, so that's a big thing, is that listening, because I think there's a lot of times we go through our day and we miss those little, like they're just like little pebbles in the water, right? And we just miss it a little bit. And if we can listen for it really well, you're kind of like, you do a double take. It's like, oh, wait, there it is. That's change talk. They're actually saying out loud that they're considering this and that this is something on their mind, that this might be important. Okay. And that's when you really hone in the listening. And that's one of the biggest things you can do as far as motivational conversations. Anybody else have any? Yes, Marissa.
Hi. Yeah, I feel like I really want to listen or want to share something with somebody who doesn't have an agenda. So when I hear that they have an agenda, that they are hoping for an outcome that I'm not saying, that makes me just shut down right away.
Perfect. That's a great point, because I think that this whole concept of motivational conversations and interviewing is going into the practitioner world because of that exact thing. We get our expert hat on, or we have some preconceived judgment about where this person should be. And so when you come to this conversation, and like I said, it could be as simple as giving someone their coffee. You really come into the conversation as if they're the only one, and that you're listening to them and waiting for those key moments, and that there is no agenda. You don't have another agenda except for that person and what they're saying. Okay. And that's a huge, huge, huge piece. One of the big teachers in motivational interviewing did this experiment where whenever they checked out from the grocery store, in order to hone their skills better, so they're in line at the grocery store, right? And they have their checkout stuff. The person would take, because they're short conversations, right? But their goal was to learn something about their checker. Like their goal was to hear something about something of that checker that was important to them. And so, it wasn't always successful. And Kelli will talk about the skills you can use, but that was his goal. By the time his groceries were bagged up, he was going to have some information about that checker, or had some sort of motivational conversation with them. Okay. Even if it's just really brief. Some of those brief conversations can be the most impactful ones you can have. Okay. And so what we're talking about right now is our next slide. And that's really the biggest piece I think that's important with motivational conversations is this spirit. And you guys brought up everything really about that. A lot of times people focus so much on the skills of motivational conversations, they really forget that one of the prongs is this spirit you bring to that conversation. And it's a really, really important component. Because if you don't have the hat of motivation, if you don't have the spirit of it, it doesn't matter how good you are at the skills or how much any of that is happening, because the person will just shut down and they'll be resistant. And like Marissa said, that's just like not happening, right? There's just this feeling of backing off. When you're in a good motivational conversation, you actually start leaning forward. It's a very subtle thing, but that's what's happening. Is the person is leaning a bit forward to you. And so this is the spirit. And this is a really, I think this is, again, my piece of what I think is the most important part of motivational conversations. And so when you, like you guys already brought up, when you have motivational conversations, you're really going to be thinking and trying to be in the mindset of partnership. There's no one up or one down. It's a partnership. It's collaborative. Okay. So that hopefully will help you take off any of that preconceived notion, or this worked for me, so it will work for you. Let me give you the 10 steps of ideas that I have for you. Let's, this worked over here. So here's how you can do it. Here's the ABCD of it. Now go off and try it. That's so when you go in with partnership, you really kind of have an understanding that it isn't, it's a two-way thing, in the sense of there's this respect for this other person, and around partnership is before you even do anything with that person or use any skills, you always ask, you always want to ask permission. Okay. And that's really a thing that's helped me keep that partnership hat, is if I'm going to give a suggestion, I always ask permission. And that's a big deal. And that helps that conversation feel more on an equal level and better for them. And again, you guys already mentioned this, is there's a sense of acceptance of their human innate ability to have change. Okay, so there's this inherent belief system in their worth. This person is a human being, and there's an inherent belief in their worth to change and do the things that they want to do, where they want to get to. Okay, and then that's a big piece of motivational conversations, is you're not only partnering, but you also have an inherent belief in them. Okay, and in change, and that a person, no matter where they are, if they have a nugget that they want, they can get it, right? If there's something that they want, or they want to change, or they're thinking about, they can do it, and it's them. And so it's that inherent belief. Okay. And then of course there's compassion, there's empathy. I would like to change that to empathy, right? There's a lot of empathy in this. And you don't have to bring your story always to it unless they want you to, right? That's the permission piece. But there's an empathy to change. Like no matter what the change is, we all have gone through it, and it is not easy. It's very, very difficult to change any kind of behavior. It is like you're fighting with yourself the whole time. And so when you have empathy, you're really going to get less, you're going to get less of the backing off, and you're going to get more of someone coming towards you. People want to be around someone who's empathetic. That's the spirit, right? People want to walk towards that because it has no judgment. It's kind. It has inherent belief in my worth as a human being. And then the next part that's really a big, huge piece in the spirit as well is being evocative or evoking, right? So you really want to evoke from them. And if I can say this, in the biggest thing is, you don't want to evoke from them the barriers as much, because those are really easy to focus on. And in our society, we focus on barriers a lot. But you really want to evoke from them when you hear Brian say that little bitty seed in the pond that makes a little bit of splash. When you hear the change, that's when you evoke. Okay, that's when you do the double take, and you're like, I'm sorry, what was that again? Right? What did you say? And then say, oh, but then you're going to start evoking on the side of why, what is important about this? What is the benefit to this for you? What you're going to it's like having coffee with someone. Okay. So if a friend comes and they have some struggle, what are you bringing to that? You're bringing curiosity, right? I want to know what your struggle is. I'm going to listen. I'm going to evoke more questions because I want to know about what's happening for you. I need more information. I'm going to be a detective on this. And so evoking from them, not the reasons not to change, but the reasons why they think this would be beneficial to them and what they've tried in the past. What have they had success with? And then you're just that's the motivational conversation, right? Even if it's just 5 minutes, if you get to one of those, and you guys end up having to go separate ways, that person's going to come away with thinking about the side of change, right? They're going to start thinking, they think I can do this. They believe I can do this. And when I think about the Recovery Cafe and people that I've had a lot of kids struggle with all sorts of addictions. I really think that there's this piece that when someone believes they can do something, and that's what I hear most of my young people talk about with their sponsor. Like, talk about a way to have a spirit of MI. Anybody who's mentoring someone in change, and that's what I would say, right? Because it's a mentor of change. And that piece of believing that they can do it is often which creates the rapport, the buy-in. That's the hook, right? And you can't leave that. That has to be a constant part of your conversations, is that belief. It's a huge piece. And you're going to keep evoking from them. I remember you told me something about why this was important. You had this, oh yeah, that's right. You own this house. Tell me about that again, right? So you're going to keep using And these conversations can build, right? They can build and they can build and they can build. So you can have a little one here and a little one there, and you're putting in your memory bank these little seeds, and then you keep coming back to them. Okay. Any thoughts about this spirit? And sometimes when I think about the spirit, I always think about this when I was a young woman, there's one person, I still remember her, who literally said to me, "You're really good at this. You shine when you do this. Have you ever thought?" And to this day, she, like, the way she spoke to me and what she believed I could do changed everything. It's what I'm doing now. And it's that piece of someone actually seeing you. And it's not that they're just seeing you. They've listened to you enough that they've heard that what Brian mentioned is that little outward voice that said, I wonder what it would be like working with kids. Right? Somewhere I must have said that in a little little small voice, and she heard it. And I think that is a huge piece. You have to catch those small voice statements, and then you believe in it and you get the ball rolling. It's like a snowball on top of a mountain, right? You hear it, you're kicking it off, and you're going to evoke what that would be like. What would that be like for you? What would that look like? What would be the benefit of that? And you're gonna be super curious. And the belief and all of that is just solid. If you do that, if you have that spirit, the skills, they just come secondhand. Okay. But it is true that it can't be about you. So when you come to these conversations, if you're the one that needs the conversation, that's perfect. That's great. But if you are, really trying to do a motivational conversation, then you really have to put you at the door.
One thing I wanted to say, Shannon, because you asked what was our reaction to the period of MI, and one of the reasons that we wanted you to come and share this approach with us and these skills with us is because it so much aligns with our values here at Recovery Cafe, with how we see people as having inherent worth, as all being deserving of love and belonging and healing, of being totally capable of taking control of their own, recovery journey, and how we treat people, how we think about them. I love when you brought up just being curious about somebody. At Recovery Cafe, we are all experts on our own experience, and that's it. I'm not an expert on someone else's experience. I can maybe share my story and maybe that's helpful to somebody. Wonderful, right? But it is never our goal to fix somebody else, which is why I love this approach that is, because it's not about that at all. It's more, it's about exploring really with somebody else on what's possible here.
Yeah, it really seriously is. And I would say some trainings focus more on those skills, which we're going to go over real quick. But the thing is that it's really the spirit that you can't go any farther if you don't have the belief that someone's inherently worth their story. And I would say that telling your story, it is powerful, but a lot of people, there's been studies around this where you start telling your story and other people in their mind that are listening that might not be as experienced in listening or having a foundation of listening to someone's story, they instantly start thinking of the barriers of why that wouldn't work in their life. We instantly will go to barriers and resistance, and it's just our brains, it's how we work. So really, you have to be in the right mindset to hear someone's story. And a mindset of love, right? Because you're doing it for that person. And so when you have motivational conversations, before you do that, it's the permission statements. You always want to ask permission in a way of like, if they're curious about something that's worked for you, because then you're switching, right? You're taking it from them to you, which is totally fine. But it's one of those things, if you're thinking you're getting a conversation going motivationally, it makes sure you want to make that switch, because you can say, oh, I'm really still curious about what this is meaning for you, if you're not ready for that switch with them, or if you think that would be too soon. Like, because that can be a distraction thing too, right? You get someone talking about them and then all of a sudden that little voice that said maybe gets cut off. So,
So when he comes, Carol, don't tell me.
so yeah, so that it's a very, very tricky little thing. When you feel the teeter-totter kind of go into something else, a distraction, or maybe, right, then that's fine. You just have gone out of motivational conversation. But when the teeter-totter kind of is still on them, and that little voice maybe that said, I'm thinking about something I'm going to change, then go with it as long as you feel like it can go, right? There's a sense of feeling around it too. Like if it's going, keeping evoking questions and asking them the benefit and really zoning in on listening to them, because that's what's going to move them more, because they're talking out loud. And when you talk out loud, you hear your reasons. And so that is a really important process for everybody, is to talk out loud, right? Because then you hear yourself, you hear your thoughts, and you're having that out loud conversation, which I know is kind of weird, but it is very, very true. I think they call that metacognition, is when you're like talking out loud to yourself or hearing yourself talk about something. It solidifies things a little bit. All right, so the primary goals of motivational conversations really is to help someone kind of minimize or reduce their own resistance, not their resistance to you. You should not be even part of it. If you're a part of it, then that's not a motivational conversation. If they're saying, well, Denise, if you didn't say, right, that's not a motivational conversation. So you're really saying having them lower their own resistance, right? So the way you do that is you really focus on the benefits of the change that they're talking about. And the change, I'm serious, it can be the smallest thing, like, I'm just going to come and meet you for a cup of tea, or I'm just going to show up here for this. That could be the smallest change. Or I walked in the door today, right? Whatever it is, it can be a small little movement. Okay. And when you have somebody talk out loud, and they're talking about, oh, I don't know, maybe, right? That's a great spot to be in, because they're considering all sides, right? They're ambivalent. They're kind of like, what? They're not standing firm. When someone's standing firm, that can be a decision, right? They've made a decision, and that's a very stuck spot, right? But if someone's like, I don't know, maybe, but maybe, but maybe, right? That's a good spot to be in, because they're considering movement. And that's when you want to hear the but maybe. Oh, what was that again? Right? Because that's a side of change. So when you go on the teeter-totter, right, you want to talk and make questions and elicit and evoke things on the but maybe side, okay? Because that's going to have them talk out loud about those reasons for, which we often don't get a space to do, right? We much prefer to talk about the reasons not, and how nothing's going to work, and nobody's going to be there, and this is never going to happen. Okay. So really, if you give them a space, let them talk about the reasons for. All right. Because those are going to be big things for them. All right. And then anybody have any questions about that? All right. All right, good. So this is another thing that I've learned recently that's different than some of the technical kind of motivational conversations that happen. So if you think about change, and I'm a big outdoor person, so this is like really speaks to my mind, but change is really the reasons why you want to do something are called the top of your mountain. Okay. So it's like the summit for me. And some of those things that people have for the top of their mountains are the things also that maybe are at stake for them. So relationships with family, freedom, independence, job security, growth, well-being, accomplishment, right? Some of those things at the top of people's mountains, that's their motive, that's the top, their goal kind of overall, or what they might have at stake, right? So they're set in a positive way. So, if your freedom is at stake, well, freedom is the top of your mountain, right? So that's a thing I want to work towards and have independence with. Health, right? That can be a very big top of the mountain. Job security or financial security. So when you learn that from somebody, it's a great motivator, right? Because anybody who goes hiking knows as you get higher, when you climb a mountain, you can see clear, right? You get above the tree line, and then you're able to see the top and your goal, and kind of help motivate yourself a little bit better. Okay. But when you're in the beginning of change, you're really in the trees. You're down here at the bottom. And all these things down here are the things that can help you sometimes, you know, or hinder you sometimes. Like it can be you drawing you off of the trail or helping you kind of stay on the trail. But it's pretty hard to tell where you're going or what path to take, right? It can get very, very difficult in the tree line. And you want to sit down, you want to give up, you might want to turn around and not, right? There's all sorts of barriers. And there's all sorts of little reasons or rewards to change. It's all mixed up in there. So sometimes what I like to think about motivational interviewing or conversations is my goal is to really connect with them and remind them of their top of their mountain, and really help as much as I can have them see the trail to that. Okay. So even if it's, you know, I'm going to try to elicit it coming from them, but I also need to know what their goal is, right? So when you ask them the benefits of change, you're getting their top of their mountain, which then can focus them in a bit and can help them stay on the trail, right? When they feel like they're going to give up, or it's not worth it, or this is too hard, I need to sit down. And those are all things that are natural, but you also want to use the top of their mountain to kind of help focus them. I know the GED doesn't seem really important right now, but remember, you said the benefit of that is what? And then what does that get you? And then where's that, right? I'm leading them up. Oh, that gets me a better job that I can afford to support my family, right? Because these smaller things down here that get you to the top of the mountain seem hard and maybe not so important. But when you learn about somebody's overall motivation, you can really start helping them get through the trail. I don't know if that makes sense, but linking it to their top of the mountain is very, very important. Like I remember when I was a kid, right? I wanted to work with kids. And when I said it a little bit and then the person validated that, they heard it, then they asked, why? Why is that important? Well, because I had such a shitty life, I wanted to make a difference, right? I wanted to help others. There was my top of my mountain. I was a helper. Right? So from that point forward, all I needed to be reminded is the overall goal. I mean, you know, that's trickier than it sounds, but we don't have a long time. So, but anyway, the biggest thing is if you're sitting and you're talking to somebody, get the top of their mountain. And you'll see it because it'll be a spark a little bit, right? The reason will be a little bit like there'll be some push around it of motivation. Any thoughts on that one? All right, this is from Casey Jackson, who's a big trainer in this, and he does more holistic conversations about motivational conversations. And so he's a Washingtonian, and he has some online stuff, but this kind of, when he talked about this, helped me kind of focus in a little bit more on, oh, I need to link this to what really is overall important to them. What are some top of the mountains people have? Like you folks, what are your reasons and motivation in general? Marissa?
Definitely freedom.
Freedom. Yeah. What else?
I'd say
Enough money to retire.
Money. Yeah. Money's a great independence for your freedom of work, which I'm on board with that. What else?
Peace.
Peace. Yeah. No kidding. Peace is huge, right?
Yeah. Peace in my heart, and helping and knowing that I've done something worthwhile, you know, that matches my my goals.
Yep. Some people are internally motivated. Other people are externally motivated, right? Family is always a big one, right? Family for me is really, really big. Anybody else have ones out there?
Well, I retired about a year ago, and one of my goals in retirement is to revive my visual art practice. Where it's
Yeah.
about communicating visually I'm a pretty unconventional artist as well. And
That makes me curious, but I won't ask you any curiosity questions.
yeah,
We don't have enough time
It's
probably, but that doesn't make me,
probably.
yeah. There's curiosity, right? When you can, like, you're like instantly somebody says something and you're like, "Oh." Okay, Brian, are you writing all these top of the mountains down? Because this is your hook. Or...
I'll try to memorize them all.
Yeah.
Oh, yeah.
Good. All right.
Or check that recording.
I'll check the recording.
Yeah.
Good. All right. Excellent.
Good. So I'm going to just kind of jump you guys into, and I'm really going to graze over this because again, right, am I is a big concept, but really just trying to stick with really and echoing what Shannon was talking about in that spirit of am I, you know, and I can't say enough. And I think we probably all get tripped up in this, whether we're clinicians, whether we're volunteers, whether we're staff in a particular place, right? If we're in a place of service or wanting to support or encourage people, we go into it really excited with great skills of motivational conversation. And because of nature of who, right, we are probably in all of these boxes, we have to be really careful of not quickly jumping into the writing reflex, right? Because we want to help these folks and we want to jump into action, but it's not about our action. And so we really have to be also not only aware of the conversation that's happening across from us and really being intentional about listening. It's also really trying to keep our mind quiet. Because for me, right, I can, as they're talking, I'm formulating in my mind, oh, what could they do? How would this look? What I should say this, what question am I going to ask? You know, and that's really hard sometimes. So it does take some practice just in the whole spirit of, right, acceptance and that collaboration part of it. You'll have your time for sure to be able to share your information and your thoughts. You'll know because they'll ask you, right? And then you really know you've actually hit that stage or that part of acceptance or continued collaboration. I think, and I'll get down to kind of the 4 types of talk, but somebody when I was doing some training actually really talked to me about resistance talk. Often maybe that people absolutely don't change, but sometimes we have to be really cautious if it's not that they're just resistant with us. So resistant talk can often be a relationship. And that's that person sitting right in front of you. And so even though we may be eager to support and want to help the direction of it, we also have to make sure that we're not ramrodding them, right? They sit down and we jump right at their table and we're like, okay, let's get into this conversation. Sometimes we can do that, but just being aware of those spaces is really important for ourselves as well. So checking yourself is important before you step into a conversation. So has anyone here heard about the stages of change? Stages of change, a little bit, thoughts out there? Tell me a little bit about just your definition of change or concept, Brian.
So my best understanding is that the stages of change help us to think about the process that someone goes through with any change in their life. I had first learned about it in the context of substance use. So thinking about someone's relationship to substance use. So maybe to help me describe it, I'll contrast it with a way of thinking about it that some people still maintain, but I see it as sort of old paradigm perhaps, which is that if someone doesn't want to change their substance use, then they're in denial about it. And we need to confront their denial and overcome their resistance. It's kind of combative and a bit paternalistic, I would describe it as. So instead of that, the stages of change recognize that it's kind of this spectrum along which someone might travel in determining what they want their relationship with substances to be like. It would go from pre-contemplation, which is before they've considered making any change, contemplation where they're thinking about it, and I may get some of these names wrong, but then planning, action, maintenance, so on. Well, there it is. And that people can go back and forth on any of these or jump to different stages. Anyway, that's my best primer, I guess.
Yeah, perfect. And that's exactly it. You really hit it on the head of, and this isn't necessarily something that like when we're having some conversation with people that we have to be like, oh, you're in contemplation or you're in action or maintenance. Sometimes we may use those, but it's just for us to kind of be aware of that cycle. And I really appreciated Brian in the very beginning saying recovery or whatever, right? The foundation of Recovery Cafe may be about substances, but oftentimes with substances and addictions come many other things that may need to change in someone's life to actually then to get them in this cycle of change around their own recovery based on substance, okay? And so if you have multiple things in your life you're working on, your change cycle is going to very well look different for each of them. Sometimes they may flow simultaneously together, but most often, right, you're going to be in one particular stage with one change you're working on, and then with other changes, you're going to be in different, or you make some change and you get into like that action part or the maintenance part, and then other things really start to change and become more fluid, and you get yourself into the cycle of that. Again, recognizing the change cycle is just important because it's about, you'll hear that in people's conversation. You'll know whether they have no intention of change, they have no planning, they're only focused on their behavior and their desires. Or if you start to hear some wavering, like Shannon was talking about, the buts, the maybes, if I could, but I can't, right? There's still some kind of now contemplation. And so as you're starting to, right, have these motivational conversations with people, think about after the fact, if you can, as opposed to in the moment, where were they? Where are they on the change cycle? Okay, and then what are kind of some next steps for them? And then recognizing and honoring. There's no shaming or blaming if someone's in pre-contemplation. That's just where they are, right? I think on some level, probably if they're coming into the cafe, there may be even eke out a contemplation, or maybe they have their foot in pre-contemplation and contemplation. And so they can kind of waver back and forth. And Brian, you're exactly right? We can be in maintenance and be doing really well on whatever change we may be working on or focusing on, and we can kind of fall back for whatever reasons, life reasons, back into contemplation. Is this worth it for me? I don't know. What's the value? What's the benefit? This is hard. This is difficult. I wasn't successful. Okay, and then they have to get back in that cycle. Sometimes they can move through these changes pretty quickly and get themselves back into maintenance. Sometimes they get stuck in that contemplation or that preparation a little bit. Again, it's individually, whatever, it's up to each individual on kind of how they flow through that or how they recognize that. Any questions or thoughts on the cycle of change or the stages of change?
So I have at the very end, I'll show this in a different way, which is kind of a cool way. So, but for me as a person that works with people in change, often with lots of different pieces of change, it's helpful because I know kind of then how much empathy, how much permission I ask, how much evoking questions do I need. It helps me kind of with those tools on maybe when to try them out a little bit more than others, right? Because when you're pre-contemplative, I'm just going to have lots of empathy. You know, I'm not going to be much more than just empathetic. So it's kind of nice to know where they are so you can kind of help yourself know which little bit of a hat to have on. Most people, though, are contemplative. I mean, you know, in the justice system, we definitely see several pre-contemplations, but still, even with all the kids in 25 years I've worked with, I've really pre-contemplation haven't really seen a totally stuck person. If they can at all see the side of change, like even for someone else, then they're contemplative.
Perfect. So we'll just quickly, because I don't want to run ourselves out of time to leave you guys with some questions, go over really 4 types of talk to really kind of be aware for and listen to. So as we're talking about that stages of change or the cycle of change, it really goes back to the very, very beginning in that maybe if they're pre-contemplative, and I totally agree with Shannon, probably most people are in contemplation or staggering it. But if you're hearing that kind of that resistance talk, like there is no reason. They can't even find an imaginal reason to change what's going on for them. And then the other side of that, again, just be cautious on that resistant talk. Is it more about your relationship? So they're just being resistant, particularly with you or their provider or their therapist or whomever that may be in front of them at that particular time. That's the easiest talk to pick up on, right? I don't want to do it. I'm not going to do it. There's no benefit in it. It's never going to happen. I've never been successful. It's all those kind of, it's almost like the ER talk, the Eeyore talk, right? The nope, can't happen, can't happen, can't happen, can't happen. And that's okay, right? We just have to go, we have to allow people to go through that cycle, because oftentimes if you get in this conversation, they quickly talk themselves out of it, because you're going to pick up on one little nugget that they may say to you that's like, oh, that seemed like a little bit of contemplation kind of discussion or contemplation kind of talk or thought. Okay. If they're in that resistance talk, you have to just roll with it. Okay. It's really easy to become frustrated, upset with people who are in that just resistance when we have such a stronger belief, or we hold much more hope for them than they do for themselves. And really the only thing at that point is you don't want to engage in argument or, telling them you never give yourself credit or you're better than that. You really just want to kind of respond back with reflective statements to them as to what they're saying. So, sometimes when you get those reflective statements, somebody will be like, well, no, I don't really mean that. I'm not that down on myself. I don't feel that deep into the hole. So sometimes that will prompt them to go, oh, ooh, I said that, and shifts them kind of naturally. Otherwise, it's just allowing them to hear back what they're saying out loud, because that, right, sometimes again, that what Shannon was talking about, that metacognition, and then somebody reflecting it is very helpful to folks. Okay? And then there's sustained talk. And sustained talk is pretty interesting, I think, just in the sense of it kind of really, they want to kind of stick where they are. They want to stick with their behaviors. It's really what, their desire to really like, I'm going to continue to do this behavior because it's worked for me, or I'm not going to do it because it's harder on the other side. It's difficult to stop using. It's difficult to stay clean. So it's like, there's not, they're sticking in their behavior because they don't really see the other side of that. And again, you really want to just allow them to go through that cycle and give them really empathetic, right? It goes back kind of to that empathy kind of approach, and give them kind of that reflection. Like, so for example, like I couldn't change if I wanted to, right? I could never change if I wanted to. You could say, so you don't see how change is possible. And so it's just reflecting what they said, but in a little bit kind of different way. And as you master kind of your return and your reflections, sometimes you can really start to emphasize maybe the little nugget that you may have got out of them that is going to shift their thinking just a wee bit. Okay. Things don't happen overnight. And so we have to be patient ourselves with the process as we're working with folks. We have to be patient in our own cycle of change, right? So we need to afford that to other people that we're wanting to support and work with. Change talk, right, is pretty clear. You'll start to hear it. You'll start to recognize it. You may even see just a different physical demeanor. Besides what they're saying coming out of their words, they may be holding themselves a little bit differently. They may look a little bit different. They may have some vibrance in their eyes. And that's right. That's where you want them to be, is in that change talk. And this is a really hard thing, right? Because it's easy to fall back out of like, oh, I'm going to do something. And then I kind of have some accountability. So this talk kind of conversation can waver. And when you're they're in that change talk, that's when you really want to start evoking and asking them questions. Okay. Explore what's going on for them. Ask them to elaborate a little bit more on their change or how that would look. Have them give you examples of what that may be. I sent Brian a little just kind of sheet, 10 strategies for evoking change talk. So they're just some simple kind of little questions, and he can hopefully share that with you folks at some point, or put it on the website if he'd like. But just kind of, again, it goes back to that being curious. The more you're curious about and evoking, then the more they're going to start talking, and the more information will come out for them. And then commitment talk, right? That they're ready to go. When you're hearing commitment talk to change, what part of the change cycle do you think that they may be in when they're in commitment talk?
Preparation.
Preparation. Yeah. Perfect. Any other thoughts?
I don't remember the names of the different ones. Oh, action.
Yeah, it really could be both of those, right? And again, it's that kind of that waiver or that deciding, but preparation for sure, sometimes even in action. Okay, and that's just part of the process and the steps of it. Well, any question at all or thoughts, comments around the 4 types of talks? I know that was kind of a quick go through, but.
Sure, I'm Kathy. I guess what I gleaned and probably what I'm going to share is what both of you guys have already talked about. And that is one of the things that I've learned when I'm having conversations with people who are struggling and celebrating as well. It doesn't always have to be about something that's going wrong. That in our conversations somewhere along the way, I like to help them become aware of what it is that's going on. And it could be an action, it could their own action or actions of others, to have them bring that into the conversation. And I realize that once they're aware of what's going on around them, they're a lot more able to share that. And in sharing that, and it was one of the things that was brought up earlier, that by talking out loud, and I know that about myself, is that things become a lot clearer. Clarity is really important for me. And the only way I seem to be able to get that in the best possible way is through communicating with somebody else. And then once they start taking, it's kind of like the acceptance is to allow them and encourage them to start where they are. Good, bad, or indifference. Wherever you are is where you begin. And most people can just say, well, they're not even sure of that. And by not being sure of that, then we can start a conversation on that part of it. And then when it comes to the action part, it's kind of, to encourage them to take baby steps, bite-sized pieces. Because I know for myself, one of the things that's been difficult for me is that I want everything to change now. And that's really defeating for me because it doesn't happen. Not only does it not happen for me, it doesn't happen for a lot of people. And to be able to get them to talk about it and then be able to say, okay, this is where I am. Maybe what I'll do is walk through the front door of the Recovery Cafe, and take those little steps. And it's like if you do, for me, it's if I do what's necessary, then after that, I can do what's possible. And then everything opens up for me. And it's like, then I can do the impossible because it's all just a cycle for me. But it starts with those baby steps. So anyway, thank you guys.
Right. Yeah. Thank you, Kathy. I appreciate you sharing that. And you're really right. And I appreciate the point of bringing up, like, celebrating the good things, right? Having that motivational conversation when things are going really well for somebody, or they have a great thing going, but they even want to change it more, right? Sometimes, we unfortunately are just terrible as a country of recognizing all the great things that people do, right? And those steps too. So you can really, there's so many layers to motivational conversation because you can insert it in lots of different kind of ways and approaches on how to go through things. And it doesn't necessarily have to be a huge problem. It can be a dilemma about a decision, one particular thing that they want to do or not do, right? Do I want to be in this place or do I want to be in this place? Do I want to work here? Do I want to work here? You can still have those kind of same conversations with people and listen, really with the spirit of MI. Okay. I'll toss these oars up here for you. I think Brian said that you folks have all had a chance to see these, or if you were on one of those previous calls, right? These are just as really kind of an approach on how to have that conversation open-ended conversation. Shannon talked a lot about this, right? If you know you're just getting no, yes, maybe, I don't know, in your conversation, you probably are not asking open-ended questions, okay? When you ask an open-ended question, you want to have some sort of response that's maybe more than 2 words or 3 words, okay? It doesn't have to be a big, right, long dissertation or all planned out or thought out, but you really want to get them to that point where they're talking about it. And oftentimes they'll say one or whatever, they'll say one little sentence. I'll be like, well, anything else? Or tell me more about that, right? And then having that pause or allowing that space of silence can be really, really awkward in a conversation, but allow it to happen, right? Because oftentimes that silence, sometimes gets kind of confused with resistance. And oftentimes it is just the fact that they're trying to formulate, right? They're contemplating in their mind how they're going to say that or what direction they're going to go. So if I can't say it enough, be okay with that silent process as you ask questions and you evoke things from them and give them that time to kind of process it a little bit. Okay. Affirmations, of course, are important for anybody. We all love them. So, when folks are trying to work themselves through the change process and work towards the commitments, we want to affirm and recognize what they're doing and the effort that they've put into this, and keep feeding that. And it's a real fine line because we can go over the top. We want to do it in a real authentic way with intention. So, it's that people are really recognizing, our spirit and our holding hope and our compassion for them. And then again, reflections, those are just really kind of stating back to them kind of what you heard from your conversation. And that just lets them know that you're sitting there and you're really just kind of listening with open ears. Okay. And the summarizing, the same kind of process, just summarizing overall the process of where they are, what's gone on. And these ors is kind of the ors can happen in many different of your conversation. It's not like I do ors in the beginning and I summarize in the end and the change has happened, right? Ors is kind of fluid throughout your conversation.
I have to say, I love the summaries. I've been really practicing them. The other thing is you can just pick one of these and really try to practice them. But summaries I enjoy because, I get to summarize the side of change, and that's kind of tricky, but that's what I do. And I always start off like, it's a good way to move to something else. And it's kind of, if you feel like the conversation's kind of gotten to its point, maybe it's done, the person seems a little like, okay, you got as much as you got. You can always be, I really appreciate this conversation we just had. You just really told me some great things about, the fact that you want independence and you really want to get a place that is yours and not with somebody else and roommates. Right. So I'm going to summarize what they told me and I'm going to connect it to the top of their mountain. Right. I'm always going to bring it back to the top of their mountain. Those bigger goals or reasons for them. They're just really, maybe it's because I've just been picking summaries this last, every 3 months I try to rotate, but I've really been trying to work on my summaries, which they're kind of hard. So give yourself some lenience in practicing these.
Okay.
Yeah, and this looks like a really busy slide because it is, but I wanted to show you it because it's also very, it has kind of everything wrapped in one. And so if you look at the red part, so in the red, it says resistant talk, and then in the bigger writing, sustained talk, change talk, and then action, commitment talk, right? And then it goes through some of the stages of change. Pre-contemplation, you're going to get a lot of resistance talk, right? And then sustained talk, you're going to get contemplation. It's going to be more the ambivalence. When you have change talk, you're going to get preparation, right? You're going to get some, well, maybe next week. And the next week comes, well, maybe next week, right? Preparation is really that. Like you keep making dates until you move into action, which is, I did it this week. Oh, right. And so if you think about the red, yellow, green, like, it kind of is like the red is where you're going to get the most stuckness, right? Someone's going to be really rooted in their behaviors and even though they get the maybe really negative outcomes, they're still, and maybe even their health is at risk, they're still going to be up here in the red and yellow and be really rooted. It doesn't mean you can't get some change talk out of them. It just means they're going to be pretty rooted. And so then if you move over, then you have MI, intentions and interventions, right? So when you have the reddest, you're going to be the most empathy. You're going to have you're going to respond with the most empathy. Man, this must be so hard for you. You really aren't feeling comfortable with all these outcomes. And this must be really, really hard for you, right? You're going to have only empathy, right? You're just going to empathize where they're at. You're not going to try to do anything different. You're just having empathy. And as you move to more change talk, that's when you can do more focus and planning and pursuing of like, okay, we set another date. Let's do that again, right? You can get more dialed in with the actual steps and support that you can give them. And you'll know these from people that you have seen go through this or yourself, right? The more you move towards action, right, and maintenance, the more dialed in you get with your steps. Okay. And so and this kind of helps me with people because I can tell my flow. Am I going at their pace? Right. So sometimes I have to speed up with my support because now the person all of a sudden has really gone into action and they want, some actual steps and more guiding, right? Because that's when I'm going to guide more and ask for permission to give them suggestions, right? I'm going to be maybe more helping them plan. We're going to be right? It's partnership, right? So we're going to be moving side by side a little bit quicker and heading up the mountain. And then all of a sudden we take a seat and we're going to sit on this bench for a little while and something made a barrier. Now we're back into me being more empathetic and focusing in on the top of their mountain until all of a sudden they get up and, oh, here we go. Okay, let's go. I'm walking by you now and we're moving. We're trekking up that mountain, right? And so that's kind of, I love this because of that reason. It kind of helps me realize my pace can change with the person I am with, right? Because it's collaborative, it's a partnership, and it's really based on if they're in red or yellow or green, right? If they're really stuck or they get stuck for some reason, someone came back, a relationship, and then all of a sudden, right, they're sitting on the bench because they're back with this person and you may in your head be like, oh my God, this is so unhealthy. What is going on here? Are you kidding me? No, I'm going to just sit on the bench with you and I'm going to be super empathetic. Oh, you really love this person. I can tell. Yes, this person's super important to you. This is really hard for you because you care about this person and you don't like the outcomes, right? So I'm reflecting that ambivalence for them. And then all of a sudden, boom, they're back up. Here we go. So that's why I like this sheet, because that's really what motivational conversations are. It's the person's pace that you're with, not yours. And I've learned that in a hard way because I've been up the mountain at the top and I look back and where's my person that I care about that I'm trying to mentor they're like nowhere to be found. And I've gotten to the top of the mountain again. And I'm like, where are you? Well, they've sat down way back there. And that's kind of a hard spot to be in because you've lost that rapport and like collaboration with that person. Or I've tried to kick someone up the mountain the whole time and that doesn't work either. So there's that. All right, how you guys doing? That's a lot of information. Like I said, I could probably talk like forever about it. It's super interesting and it takes lots of practice. I think my daughter has taught me the most when it comes to this. Any thoughts or questions?
Yeah, I have thoughts, questions. I'm in long-term recovery. I got clean and sober when I was 20, and I've been around 12-step programs all that time, and there's some of the stuff there that just drives me nuts. I mean, it even did at the beginning. Unfortunately, I landed in a rehab in Minneapolis, based off of Hazelden, and found 12-step meetings that were not typical, shall we say. But I find it's a tough thing because there are a lot of people that just say, you got to come in, you got to do this, you got to work the steps like they're in the big book. I don't know, it's now maybe a year ago or a couple of years ago, I got in a discussion with somebody I thought was kind of understanding some of this. And I mentioned that the idea of telling somebody, if you're not ready, go out and drink some more, which to me seems like abusive. I mean, and I guess really what I've found is over the years, I've at least developed some of these principles in the people that I sponsor and work with, because I've found I found some of these things that work for me, but things that work for me don't work for other people, and vice versa. And yet, anyway, I guess maybe my question is how do you approach this kind of mindset coming out of the 12-step programs and all that, and how I guess there was a time I thought I want to get A to rewrite the big book and all of this, and that's not going to happen.
You know what
But
I'd
I
say,
find
Bruce?
I can. I mean, I run a secular AA meeting on Zoom called Heretics and Misfits, and it's really like, just show up and say whatever's on your mind, and it's okay. So that's the thing I can do. I can't change other people's minds who are stuck in that mindset.
Yeah, and I think this is I really appreciate all your comments, because we have our own path and we have our own pieces that worked. And I would be like, Bruce, what worked for you? What parts of that 12-step did work for you? What do you like about it? Have you, like, what do you want to do next with it? So then that's what I love about motivational conversations, is they're with just one person, right? So I would bring Bruce into, like, what is it that he feels passionate about with this? And he's already done it, right? So he's started this Zoom thing. And then, if he hadn't, you would kind of motivate, talk to him and see what his goal with it was. That's what I love about motivational conversations, is you could have somebody really liking every single 12 steps, or you can have some people that like 10 of them or whatever, 5 or 6, right? And then what do you like about those? What works for you, those, it's just about them. Yeah. It's good stuff. It takes practice, my friends, and I am no expert in that way. I get hooked, lined, and sink, and I'm like, just do it, right? But it does that. It just doesn't, then I'm like, oh, Shannon, it doesn't work, right?
Practicing. I would love the opportunity to practice with other volunteers. How to do it, and make a bunch of mistakes so you know what not to do.
There's this game you can do that's called the batting cage, where you create all of these, each group comes up with these scenarios like resistant talk, and you're on teams, and so then they bat the ball to the other team with resistance talk, and they keep MIing it, coming up with the ors, like examples of how they could, and if it's successful, right, then they get to pitch to the other team, and you kind of keep going back and forth. And it's a good way to practice because you have more of a team atmosphere around it.
Wow.
And if you have any kids or family members, it's great to practice with them, or spouses or significant others, because, they may not know right away that you're doing it, but, and there's really no mistakes. You'll feel the mistake, really, Katie. The only mistake you're going to have is you're going to feel resistance. All of a sudden the person's going to go like this. And then you're like, oh, okay. And then you try some empathy. And that's what you can always fall back on, is the empathy that'll move you closer. But I think the practicing, like I said, I pick one ors and I kind of research one at a time. And there's all sorts of online things that will give you examples. Like there's like 4 types. Well, there's probably 100 types, but 4 types of reflection statements that I pick one, a week, and I just try to practice it. with anybody that I come in contact with. Like, seriously, this guy did it in the grocery checkout. And so I think anybody that you care about, you can use this stuff with.
Oh, and you were going to put that book in the chat?
Oh, yeah. Thank you. Could you follow me around all day and
Remind me.
all the things that I was going to do?
I know Shannon and Kelly had a couple other resources, I think. I know I got that worksheet that you sent, Kelly. So if there's any others, including this book, I will send a follow-up email to this training with the link to this recording, so you can all review those materials. And something I will say too, Katie, because you had talked about practicing, which I completely agree, like role playing, practicing is the way that we develop these skills. Part of what we're looking at for this coming year and kind of going forward is, you know, with these monthly volunteer trainings becoming workshops open to the public, we are looking at what ways do we support our cafe companion volunteers, meaning that'll probably be smaller gatherings of those volunteers where we debrief, here's some exchanges, or here's some like topics that I could really use some practice with. And that's a great time to do some of that role playing to practice either motivational interviewing or other skills we might be needing help with. So I want to put that out there. And also I just want to acknowledge we've got about 8 minutes until the scheduled end time of this. If there are other questions, it seems like Kelly and Shannon are open to those, but if there was anything else, Kelly, Shannon, that you wanted to get in before the end, I want to just name the time real quick here.
Yeah, thank you, Brian. No, I appreciate you having us and all of you being here. I think we've kind of covered what we can in this short period of time, but for sure, if you guys have questions or if you're looking for additional resources, feel free to reach. Brian knows how to find us. And would love to just continue to be a part, right, of the organization of Recovery Cafe and support the good intentions and be good community partners for sure.
Yeah, I was really excited to come on this, and I've been trying to, you know, figure out ways to outreach or, you know, kind of be involved just even on my own personal time, not a work time thing. So I really appreciate all the work you're doing there. It's been great seeing your building and how it's forming and looking and all the hard work. So kudos to you folks for sure. And I appreciate you having me.
Looks like Marissa had her hand up. Go ahead.
Oh, Marissa.
Hi, yeah. I just wanted to ask Shannon, who do you work for? I missed that at the very beginning. What agency?
Jefferson County Juvenile Justice Court, Juvenile and Family Services. We do a lot of stuff. I work in the court involved part of it. So we do dependencies and status kind of outreach towards, you know, schools and kids and serving kids in our community. And so, yeah, a lot of families can come in here and get support and help. Yes.
Thank you for the work you both do. And I hope there can be collaborations with the Recovery Cafe.
Yeah. We have several young adults that, you know, are 18 or over that probably, because I do believe you're 18 and over, right? Yeah.
That's right, 18 and over. Well, there are definitely opportunities for that. As I mentioned, we'll be doing these workshops in person. This motivational interviewing and conversation, which I love that, by the way, that was my first time learning about that piece.
I invented it. I just thought, well, you know, motivational interviewing is really clinical, right? And you can be in a clinical field, but you can just have motivational conversations with people, which is highly effective. So I'm going to start writing a book.
Great. Well, I do think that there are, these opportunities to collaborate, and we may invite you back when we're doing the in-person ones, because I think we can't have enough of this topic in particular. So I want to say thank you both so much, Kelly and Shannon, for coming here today. Thank you all to our volunteers. Oh, Shannon, did you have something before we end?
Oh, yeah. I just wanted to say, Shannon, you were a change agent in my life when we brought our daughter to your court thing like 20 years ago. I don't know. Yeah.
Oh, not 20 years ago, Janet.
Have you been there that long?
Yeah, 25.
Yeah. So I think she's now almost 30, and you worked with her when she was a young teen. So anyway, I just loved sitting at your table during that time. And now that I look back on it, I recognize a lot of these things you just taught us. So I appreciate you in so many ways. And
Thank you.
what a gift to the community you are.
Thank you. I appreciate that. That's nice to hear. See, motivational right there. She just confirmed my
Keep it
top of the
going.
mountain, right? Now I'm gonna go climb it.
Well, again, a thank you to Kelli and Shannon for doing this for us today. Really appreciate you both. Thank you all for participating. Again, this is our last volunteer training of this calendar year. It is our last volunteer training that will exist on Zoom, knock on wood. We're going to be moving them in person in January of 2022, the third Fridays. They'll be 1:30 to 3 p.m. We hope to see you there. And also remember, next week, Wednesday, is our gratitude banquet. It will be from noon to 3. You are all invited and more than welcome. Bring a friend if you'd like. This is our way of saying thank you to all of our volunteers, members who have helped make this place what it is. So with that, we'll bless and release you all. Thank you again, and we hope to see you soon.
Thanks, everyone.
See ya.
Yeah, thank you. Yeah, very good.